Dr. Colbert is the Assistant Program Director of the Emergency Medicine Residency at the University of Illinois, where specific interest in both academic and social emergency medicine. Dr. Colbert is the Chair of Continuing Medical Education for the American College of Osteopathic Emergency Physicians, the President-elect of the National Medical Association, the co-chair of Illinois College of Emergency Physicians Spring Symposiums, and a lieutenant colonel in the United States Army Reserve. Dr. Colbert has provided and moderated lectures nationally and internationally, receiving awards for both speaker engagement and contribution to medical education. Dr. Colbert is going to speak with us today and share with us COVID-19 updates. And obviously, based on his accolades, he has a really busy schedule, and we absolutely appreciate you for taking time with us here today.
First of all,
take it away, Dr.
Thank you very much for the invitation. That's a lot of titles, but the one that's most important is I am the esteemed guest and privileged to be here. I appreciate the opportunity to engage in conversation and expand in the conversation of COVID-19 and vaccines. So I really, really appreciate the invitation. You guys, thank you very much. I am going to navigate my screen here. I've got share my screen, all right, and we are going to do keynote. All right, and we're going to press play. All right. I'm going to advance my screen here and say, all right, hold on. There we go. Can everyone see my screen? I'm getting a thumbs up. Possibly?
Yes, we can see it.
Okay, perfect. So again, thank you very much for the invitation. I appreciate the opportunity not only just to provide this insight, but this amazing conference that you are having today. It's extremely insightful. Coupled with that, with this invitation that I received, there was tons of just information that was provided to me with this invitation. And I not only use the information, but moving forward within my practice, this is something I'm going to communicate with my patients, as this is not only insightful to anyone with any concerns in reference to pathology of the kidneys, but also to physicians as well. It was a wealth of information. So it's kind of a win-win here because I learned a lot and gained great insight on information I can provide, as well as hopefully we can kind of share information today. So that being said, ladies and gentlemen, let's just jump right into it. In reference to living with kidney disease, it's extremely important to realize that this huge resource from the National Kidney Foundation is just that. It provides resources on all different aspects of information in reference to support, insight, as well as ensuring that you and both I remain informed, to have resources to have and make intelligent conversations and informed decisions. And today we're going to talk about, in reference to my aspects, is the role of chronic kidney disease or kidney pathology and its relationship to COVID-19 and vaccines. Just to give this some context, just how important this specific type of conversation should be delivered. In fact, is that went right to the CDC website. It's very humbling when you look at the numbers that 1 in every 7 of individuals in the United States, that's 15% of the US adult population, that's 37 million people are expected to have CKD or chronic kidney disease. And as many as 9 out of 10 adults with chronic kidney disease do not know they have it. And also in that same light, about 2 in 5 adults that with severe kidney disease do not know they have it as well. So it's very important to bring attention, coupled with provide insight for this specific group of individuals that require some tailored information based on their pathology. And with that, there's a different lens in which you and I see many things. And there are different lenses in which individuals that have concerns with their kidneys see COVID-19 and the management options, such as the vaccines. So sometimes those lenses can be from that of an individual with chronic kidney disease versus that of you are on the transplant list, those individuals who receive dialysis, and those individuals who have already received their transplants. So there's many different ways in which you can look through the lens of COVID vaccines, and how this management applies to you specifically. So let's kind of dive into this just a little bit more, specifically with the vaccine. And I always provide this information that the first vaccine that was provided in the United States was in New York, and that was December the 14th of 2020. Now, December, January, February, March, April. So in 5 months, we've gained a lot of information and a lot of data. However, we're not at the place where we can draw a line in the sand and say, this is what everyone needs to do in this aspect. And that's why it's extremely important for specific individuals or patients with chronic kidney disease or those who receive transplants, because the answers to your questions, what vaccines do you recommend? What is the time frame of me receiving a vaccine? If I'm on the transplant list, where do I go? Is there? It's tailored to you. So you see these answers and you require answers that are in a specific lens for those questions that you asked as well. And hopefully we can provide some insight to those specific questions today. Again, let's go back just a little bit. For definition, your viral vector are your Johnson & Johnson. There's two types of vaccines. There's the mRNA and there's the viral vector. Now, the viral vector are the traditional ways in which vaccines have been introduced, where if you can look to the screen to your left, you have a weakened or it's called attenuated or a weakened form of the virus. And so whether it's mumps, measles, or rubella, or chickenpox, what has traditionally been done is that a weakened version of a virus is introduced to our body. Now, that weakened version of the virus is introduced to the body, and it's weakened so that our immune response can overwhelm the virus so that we produce antibodies. And that's a viral vector, that's Johnson & Johnson. And if you look at the mRNA, which is the conversation that we have had starting with this new vaccine, is the fact that with the mRNA, it's a messenger. So it's not even the virus itself. It is a synthesized or a pre-made message. Now, this message is provided to our bodies or introduced to our bodies so that our bodies produce antibodies from this message. Again, put things in context. Your viral vector, your Johnson & Johnson, which is one dose, is your viral vector. That is a weakened form of a virus, where your mRNA is a message that's introduced to our bodies that stimulates our bodies to produce an antibody. So in addition to those, that's the message. In addition to those, there's also the conversation of convalescent plasma, which is a means of receiving already developed antibodies and introducing those antibodies to the host or someone who ideally you want to support with this virus. And there's also monoclonal antibodies. So again, there's monoclonal antibodies, there's convalescent plasma, there's the vaccines. We're going to focus specifically on the vaccines. And if questions arise, and then we'll kind of dive into the aspect of the monoclonal antibodies. But the focus right now are the two types of vaccines. And remember, your doctor, your specific physician sees your health through a specific lens as well. And ultimately, the options that we have and that we discussed today will be tailored based on your medical regimen and where you are in this category of pathology to your kidneys. So remember, we discussed very briefly whether you're receiving dialysis, you're on a list to have a transplant, you've already received a transplant, or you're just here just getting information for a loved one. There's different ways you're going to look at this lens, and always communicate with your physician. So the concern is, what about the side effects? So where am I, or where should I, and what questions should I ask in reference to the side effects and the vaccines provided? Well, specifically for those individuals, remember that you have an immune response that is blunted. That is more than just, that includes just the transplant patients or those individuals who are on the transplant list. That also includes your chronic kidney disease and your dialysis. You have a blunted immune response. So that blunted immune response means that with the introduction of these vaccines, your body may not have the response that someone else's body would. So again, if you have a blunted immune response, meaning that your immune response is specifically designed not to function to 100%, whether it's because you're a transplant patient or a patient that is going on the transplant list in some capacity, if you're immune compromised, your immune system will not have the same response as one would expect for someone who has a healthy immune system. So based on this fact, one of the recommendations in reference to receiving the vaccine is to receive the vaccine that's 2 doses. So I have asked some transplants, specific transplant surgeons in reference to this, and here's the thinking. The thinking is that if your immune response does not solicit the response from the first dose, you're increasing the opportunity of your body to have an immune response with the second dose. Again, there's still data that we're collecting, and there's still conversation in reference to that. But one of the recommendations is that basically you get the 2 doses, whether that's the Pfizer or the Moderna, because based on one's immune response, there is a chance that if you have a blunted immune response, that you won't get the response that everyone expects with the first dose. So in theory, with the first dose, after the first dose, you're 52 to 53% efficacy in decreasing the mild and moderate symptoms. And after the second dose, it's 96 to 97% in decreasing the mild to severe symptoms. So let's just say I have a blunted immune response. And after the first dose, my immune response does not really take effect as I would hope. So to increase the probability of my immune system really getting that good response, I take either the Pfizer or the Moderna, because I've got 2 opportunities of my immune system to surmount a good response. That's number 1. Number 2, for those individuals who are on a transplant list, you have to communicate with your specific physician in reference to timing of your specific from the donor. And the conversation is between 2 to 3 weeks, you should delay receiving the vaccine. Again, 2 to 3 weeks upon receiving or on the transplant list, there should be a delay, and having great conversation with your physician to identify, in fact, that if the blunted immune response and you received the vaccine during that 2 to 3 weeks prior to receiving prior to transplant, that there's a high possibility that with the medications that are provided that are specifically designed to blunt your immune response, that will also have a negative effect on the actual vaccine itself. So again, that timing may vary based on your specific physician's recommendations, but you have to have that conversation. And more importantly, I want you to be cognizant of the fact that having a blunted immune response will have an effect on your body's ability to really make antibodies when introduced to the vaccine. So it's extremely important that conversation and timing, your conversation with your physician and timing of when you're supposed to have the vaccine based on your medication is extremely important to have. So let's go back. there's a couple of things that we discussed is that we all see this through a different lens, and that your specific medical history plays a specific role in A, the timing, and B, the options of vaccines for you to get the best bang from your buck. So it's extremely important that you have this conversation with your specific physician, that they understand what your interests are, what your needs need to be met. And then you can marry the conversation between your physician, your physician's insight, your medication, your medical history, and what your wishes are, so that we can all move forward in a very healthy and productive way. Again, I have no actual stake in this as well, but this was provided to me with the invitation, and the National Kidney Foundation of Illinois has this podcast available. And with my invitation, this was available to me. I recommend, number one, following up with the CDC website that I included earlier in this lecture. And number two is to also follow up with this actual podcast. It's extremely insightful. It gives narratives of different individuals based on their medical history with a diverse history of kidney disease. And it's extremely insightful hearing the narrative of these individuals, and I would recommend that. So the take home, ladies and gentlemen, is number one, you have to communicate with your physician. Number two, can you receive the vaccine if you have chronic kidney disease, if you are on the recipient list, if donors, yes, you can, but the best way to do this is to communicate with your physician and identify the best time in which you can receive the vaccine, so that you can surmount a really great antibody response, so that we can move forward in a very healthy direction. If you have any questions, please utilize whether it's Twitter or Instagram, and I will field any questions at all. Oh, also there's a QR code here. You can also place your phone and take the picture from the QR code, ask any questions. So here we go. Thank you very much. Let's go with the questions. Let's open the doors and have some really great discussion.
Dr. Colbert, you're awesome. I love it. I love how you incorporated our new logo and gave a shout out to the podcast. You definitely want a place in my heart, and your information was just so informative and helpful. So we do have a couple of questions for you. One question is, what antibody test can be taken to confirm that a transplant patient developed immunity? And where can one find this test, and how reliable is it?
Okay, so that's a great question. I literally had individuals that received the, that's a great question just in general that's a very thoughtful question. And so here's the context behind that is we would get patients that come to the emergency room a day or two after they received their vaccine and ask, I want the antibody test. I want to know if this worked. So just for the record, we don't do that test in the emergency room. We don't do a verification test for your vaccine. I just want to answer that. I don't want to give you misinformation and say everybody received the vaccine and 3 days later go to your local emergency medicine hospital and say, hey, Dr. Colbert said I can get this. I did not say that. I'm saying that's a great question, and speak with your physician. There are ways when you can test for the antibody if your body produces that. You would speak with your primary care physician, and then they would probably recommend, number one, that you don't get the test and just give yourself some time and let the actual vaccine take course. Remember that if you receive the vaccine, you've got 2 weeks for the state that it has made its effect. And that's why, in fact, part of the CDC guidelines state that once you receive the vaccine, before you travel, you've got to wait 2 weeks. So once you receive the vaccine in any capacity, you wait for 2 weeks. In reference to checking for the antibody test, my recommendation is to speak with your primary care physician or your transplant physician as well. And specifically in reference to that, hopefully there will already be that conversation with you and your physician. So that's already in the works if that's what they recommend. 9 times out of 10, that conversation that informed conversation with the physician that knows you very well and knows your medical history will be very insightful, and the conversation will probably go in a direction of, I don't know if you really need that. However, here are options that we can do to answer your question and still provide comfort and support for this vaccine.
Thank you. That's very informative. There's one other question, comment, someone who came on late and is wondering if you could sum up the risk for transplant patients of the vaccination.
No problem. And the whole idea of receiving the vaccine is that your body surmounts an immune response. That's it. And whether it's the Pfizer or Moderna, which are the mRNA, or the Johnson & Johnson, which is a viral vector, they are both used to stimulate one's response. So when the conversation that we hear very often is, well, there's side effects because you have the body aches, you have the fevers. No, that's not a side effect. That's your immune system kicking in. That's what it's supposed to do. So let's just say this is 2018, which seems like years and years and years ago. People were receiving the vaccine for the flu. They received vaccines in different capacities. And they would say, you know what, I received this vaccine for the flu. And I had fevers and I had the muscle aches. Yes, because that means your immune response is kicking in as it should, so that it makes and develops antibodies, so that the severe and the really bad effects of this virus you won't have. So when you have when you're a transplant patient, you're a dialysis patient, your immune system is blunted. As opposed to working at 100%, you're working at 80%. Not a bad 80%, but something to be cognizant of. And it's extremely important when you know that we are purposely introducing something to stimulate your immune response. So the answer to your question is, the risk is based, number one, on your medication and your pathology. A dialysis patient will have a different set of expectations than a transplant patient, which is totally different expectations than someone who was a transplant patient 4 or 5 years ago who's on a different set of medications. Similar pathology, same organs, but different medical regimen. So can I draw the line in the sand and say this is what the risk will be for everyone? Absolutely not. However, what we can do is have a conversation on what the concerns would be. And again, if your immune system is blunted, you are looking at the possibility of not having a very robust response as someone whose immune response or immune system is running at 100%. And so because of that, the conversation and the diligence of timing, looking at your specific medical history, and communicating with your physician who knows your medical history is extremely important. Because that way, those 3 aspects, once they're understood and put into conversation, you will ensure the best outcome for your health.